So there's now over 300 cases in the state. So are these all stemming from the same area?
Yes, the outbreak started last year in an outbreak that included northern Arizona and southwestern Utah down here in our part of the state. So all of Utah's cases look like they're connected to our outbreak.
And what are some of the main ways that those cases can spread and reach other regions?
It's mainly airborne spread, and so anytime that people are gathering together indoors, any large event, and there's somebody that's infected, and any people that are unimmunized, and that's where we see these cases coming from.
Tell me about the term community outbreak you mentioned. I feel like at the beginning of this outbreak we saw kind of very specific towns having cases. Where is it at now?
So we consider it community spread, meaning that pretty much anywhere in the community. It's not just isolated to certain groups or areas geographically. It's anywhere that people that might be infected, sometimes they don't even know it because you may not develop symptoms after you're first infected. And so that could be in stores, churches, schools. Those places have been some of our exposure sites that are online for southwestern Utah.
And we see 6 cases now at the hospital. Six exposure sites in the last month. A lot of people in the hospital you think are, they might have compromised health. So is measles more serious to them?
Measles can be more serious to people with compromised health, and so we really encourage folks, if they think that they or a family member has measles, please call your healthcare provider first before going in person. That way they can implement infection control measures so that you don't spread that around to other people that are unimmunized.
Tell me a bit more about how it can be more severe for someone with compromised health.
So measles is especially tough on kids, infants, anyone who has a compromised immune system, older folks. Generally we see it in kids under 5, and so a kid under 5 that gets measles has about a 20% chance of being hospitalized or needing more extensive care, and a greater chance of having complications from the measles.
So hearing that it is been at the hospital, is that a concern?
It is a concern again for, people go there to get help, and like you said, they already have compromised immune systems, and so that's a place that we want to try to limit that. We don't want that at all to be a place that measles is spreading. We want that a place where people are able to go to get help. So again, measles is very contagious, and so most people will recover at home just fine. If a person is concerned about if they have the measles, if that rash is developed, call your doctor, call your healthcare provider, and they can give you instructions of what to do.
And then do you anticipate a plateau in the future, or are cases just going to keep growing?
We've seen it go in spikes. We saw a rise in cases after the holidays, after Thanksgiving, after Christmas. There are certain events that have happened in the state where we'll see a spike in cases, and so we expect to keep seeing some of those maybe into the spring and summer of this year as it makes its way through unimmunized folks. We of course hope that it goes down, but right now we're seeing a steady increase of cases, but it happens in waves.
Yeah, has it been, because I know the last time we talked, Southwest Utah hit around 150, now we're closer to 200. Has this period been a more rapid increase versus others, or?
No, if you're able to see it on a graph, you'd see kind of a up-down movement. It's not just a steady increase like that. Right now we're seeing a decline in cases overall, but that could change in a week or so.
I guess where's the end to this? How does an outbreak eventually fizzle out?
In this case, it would be once people who are unimmunized get exposed, get the illness, and then they have immunity after that. But we'd like to encourage people that if you are unimmunized, it's much safer and better to get the vaccine and get immunization that way rather than the disease. And so we're encouraging parents, if their kids are unimmunized, to at least consider maybe getting 1 MMR dose. That alone can be 90% of effective against the disease.
You mentioned that all Wasatch Front cases were tied to this region. Was anything done to stop it?
I think even before the outbreak hit Utah, public health officials were expecting this because we've seen it in a lot of other states. And so pediatricians were educated on what to look for in measles cases because really a lot of younger healthcare providers haven't seen a measles case. And so that preparation was done. As we started seeing cases in our region, it's commonly known it's very contagious. And so if an infected person travels anywhere, and it can impact other unimmunized folks. And so we've been in communication pretty constantly with public health officials, not only in northern Arizona, but throughout the rest of the state, just to track these cases. When there is part of our surveillance program means that we try to figure out where have you been, who else might have been exposed, so we can warn those people. We recommend that folks quarantine and stay home for a period of about 21 days after exposure to watch for symptoms. So despite that, there are still some folks that have measles and travel without knowing they have it. Other people, maybe still knowing they have it, might still expose other folks, and so it's a hard thing to keep under control.
And this might repeat some of the same information, but what is being done to contain the spread moving forward?
It's mainly education, and so we let people know this is an easily preventable disease. Consider getting vaccinated, and also consider who you might be impacting. So in your circle of people, if there are really young kids or people with compromised immune systems, you might be really impacting their health even if you get measles and recover from it okay at home.
And as I mentioned before, we've seen now 6 exposure sites at St. George Regional Hospital in the past month. What should the hospital be doing to keep their patients safe?
So hospitals already have in place some really good infection control measures. They're not always able to tell when people come through the door what they might be infected with, and so we work together with them on cases. Hospitals are doing their best, but again, measles is one of the most contagious diseases there is, especially as it's spread airborne, and so no matter what kind of measures we or hospitals put in place, it really comes down to people being responsible, that if they're sick, to stay home, and again, to call first before they're going physically to those locations.
Is there any way that they can monitor who's coming in, or potentially would adding a mask help?
Uh, Perhaps. So, even in cold and flu seasons before, a lot of hospitals will have notices at the front door that if you have a fever, other symptoms, please reschedule your visit. Put on a mask if you have any type of respiratory situation. And so, like I say, a lot of these things are in place, but it's hard to stop every case of a disease that can sometimes get in before we even know about it.